All right, Fox 5 Health News. Millions of Americans suffer from chronic back pain. Many turn to steroid injections to get relief, but another study now questions the popularity of this treatment and whether that's really the best way to go.
Joining us now is Fox 5 medical contributor Dr. Devi and Parampo. I'm giggling because, boy, did we just get our, 5-cent medical opinions about our back pain.
We both quizzed her about our back
when we were
issues.
In commercial.
This topic is really exciting to me because I treat back pain, right? So we should separate. There are different types of steroid injections and different causes of back pain, right? So in this study, they found that if people had something called an epidural steroid injection, that 1 year out from that, compared to people who didn't, there wasn't much difference. But, you know, it can still be helpful for certain people depending on the cause of the pain or what they're aiming for, right? So with most back pain, it's usually either related to something called the discs, which are the cushions in the spine, to arthritis, or maybe to muscle that's sort of overlying this. And it can be all three at the same time. So generally speaking, your back is made up of different bones, and in between them you have these discs, which are like the shock absorbers of the spine. And starting around the teens, 20s, people start to get tears in this area, so they might feel like a sudden pain, like they can't move, but then it kind of goes away, so they might have thought, I slept wrong or something. But that's usually a disc tear. So the disc tears, it's mostly related to age and genetics, and smokers can have more of that. Now, if it
What doesn't smoking make worse? It's incredible, right?
Well, exactly. We think of the heart and lungs, but smoking can affect this too. So, you know, if it tears, people can have back pain. Now, sometimes it's like a flat tire. If you get enough tears, it'll sort of bulge in different directions, right? So if it bulges back like a flat tire, it can hit these nerves as they're going down the legs, as they're leaving the spine. So that's sciatica. When you talk about sciatica, that's what you're talking about.
I had that when I was pregnant. Ooh,
yeah, exactly, with a lot of changes in the spine. Now, the epidural steroid injection is to treat sciatica. So it's better at relieving sciatica symptoms or leg pain than it is for back pain. So this isn't that different in that case, right? And the way that it works is kind of like a super ibuprofen, but instead of taking it by mouth and having it work on the whole body, that instead you're putting something locally in that area and maybe calming down inflammation. Now, it only stays in the body for 3 months, so you wouldn't expect it to work for a year. But for most people, the body heals itself, just like when we get a cut, you know, how that cut goes away. So in the same way, if you get a disc tear or you have some problem there, the body will heal that too. And 50% of people, within 1 month, it's already addressed. You know, within 3 months, the pain goes away. So this type of procedure is useful for people in the very short term, you know, that if the pain is so severe, that maybe it could be helpful. Exactly, while you're trying to heal.
Oh,
good deal.
That was great. Thank you so much.
Thanks.
Okay, well, if you want to increase your brain power, they say aerobic exercise, that type of workout is best, huh?
Exactly. So people do a lot of exercise, and we don't want to discount all the other types of exercise like weight training and interval training. I mean, all of those things can be helpful for so many different reasons. But if you're specifically looking at learning and memory, there's a mouse study that just came out, which is animal, not human, but nevertheless, they actually compared these types of, training, right? So in terms of learning and memory, it seems that if you do more aerobic exercise, the more distance that you cover in terms of running or biking, actually the more likely it is for you to grow these neurons, which are brain cells, in the brain. So that could improve that type of learning. So, you know, memory, it could be things like trying to remember what you're doing during the day or trying to remember something that was fun or important to you. But it could also be learning a new instrument or learning a new sport, some kind of skill, right? This part of the brain is involved in all of that. Now, the other things can still have positive effects on the brain, but if
I do feel like when I go through running phases, I do feel like when you end, like, oh, I've got a brilliant idea right here.
Exactly.
Like you do feel it, you feel it in your brain.
Yeah, so for all those reasons, it's really good. And then even for other things like with stroke, for example, aerobic exercise, it seems that it builds more of these what's called collaterals, which is sort of like if your arteries to the brain are like a highway, these are the detours. If you have a stroke or something blocks an artery, you have these detours where blood and nutrients can
I feel like I learned a lot today.
Yeah, we did. We got a lot of info in there. We probably went long, so we're going to get to Nick. Nick, we're going to keep talking with her. Tell us about the weekend, because we know the weather's getting warmer, which is good.
Her conversation is much better than what I'm going to tell you. So
sorry, Nick.
That's okay. I'll devote my time for more of what you were talking about, because even though it is going to get a little warmer over the weekend, we are going to be seeing some rain.